The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Welcome to Pediatric Perspectives, where we are taking a look at children's health challenges from a different perspective, one that includes critical thinking. We are not afraid to tackle the tough questions, and today is a fun day because Tommey takes the reins and will be asking me questions.
Well, thank you, Dr. Paul Thomas. I really am pleased to be here because we've got quite an important subject to talk about today. It's been all over the news with the Shaw twins, as you may have seen, and how the mother is now up for double count of first-degree murder. And it's not the first set of twins to have died following vaccination. There's 7 other recorded ones from around the world, and maybe more. So we are heavily coming down on the SIDS. We've recorded up to 100 SIDS stories over the years, and there's many more as well that we have coming up. So this is why I thought it's really important to do this. And I have to say, and Dr. Thomas, and you may have a different view on this, but in all the stories that I've done, I have never had an unvaxxed SIDS story.
I have had the same experience. So, I'm retired now, but when I was in practice, and I was in practice as a pediatrician for about 35 years, thankfully, I did not have any SIDS cases in my practice. I did hear of one from somebody I knew. And, if you're listening and you aren't exactly clear on what SIDS is, it stands for sudden infant death syndrome. There's SUDI, sudden unexpected infant death, and those terms, SIDS is a subset of that. But basically, you had a healthy child and then unexpectedly they're dead. And there's nothing more tragic as a parent. And sadly, this is happening a lot. So we have somewhere between, I would estimate, 2,000 and 4,000 cases of SIDS each year in the US. We have the highest infant mortality in the US of all the industrialized nations. Curiously, we also have the highest vaccination load of all the industrialized nations. Could be a correlation there. We're going to talk about that.
Also, the other thing that really upset me when I would listen to these parent stories, so they'd basically vaccinate their children, do everything they were told to do by their pediatrician, and then they would find their child dead. They would call for help, and the police would come and take these parents separately away, and they've just lost their baby, interrogate them, strip the other children's rooms, interrogate the other children. It's like a crime scene. Yeah, all they did was vaccinate their babies.
Yeah. No, it is truly sad. In fact, as you were chatting, I remembered I did have one case that was a near SIDS. It was a paramedic mom, and I believe it was sometime after a vaccine. I'm not sure of the timeline there, but this infant was around 6 months old. And she went in the shower, had a nice long shower, left her baby, awake and happy, came back and the baby was blue. She didn't know how long that baby had been non-breathing and resuscitated the baby because she was a paramedic. She knew what to do. Sadly, that baby had severe anoxic brain injury from lack of oxygen and, never, actually couldn't speak, walk, or talk for about 6-7 years. And there was, MRI of the brain showed the brain was gone, just shrunk from lack of oxygen. Anyway, it is absolutely tragic what happens to these parents in the stories. It's just horrendous. So, the latest story came out of Cook County, Illinois, where they had 208 sudden unexpected infant deaths from 2019 to 2023. What was interesting about this sampling was 27% were preterm. 32% had been in the NICU. 18% were exposed to tobacco, 15% partner violence, 29% parental substance abuse. 1 out of 6 died away from home. What was curious to me, Polly, and really was like, 14 times more deaths in that sampling in blacks. So there's a racial disparity there that was pretty pronounced. I think the thing is, we do know that some of these things that I was just rattling off, preterm, NICU, tobacco, if you're in a neglectful, dangerous environment, accidents happen. So It's not always 100% vaccines. I'm going to talk about that because of the really important paper that Neil Miller published in 2021. We're going to go over that. It basically shows that most SIDS is absolutely vaccine related, and I'll cover that in more detail.
Yeah, please do. Let's go straight on to that.
Neil Miller has published a couple incredible books showing that there are studies out there showing vaccines harm. 400 in his first volume and another 400 in his second volume that just recently came out. But I think his biggest contribution to this whole issue was his 2021 paper on SIDS. I covered it extensively in my latest book, Vax Facts, because it was so powerful. Guess what? After 3, 4 years, 5 years, that paper was not only retracted, total bogus retraction, but they actually took it down. You know, I have a copy, a lot of people have copies. You can't totally get rid of something that's been up on the web, but it's gone for the future physicians who research and search for SIDS. Unless they know specifically how to find a retracted and taken down paper, they don't have access to this information. Here's what that information showed. It is just mind-boggling. He went into VAERS and did 30 years of analysis, so 1990 to 2019. What he found, and this should be like, boom, 50% of the SIDS deaths, sudden infant deaths, so they don't know why, they just died, happened 2 days, within the first 2 days after vaccines. 58% in 3 days, 78% in the first week. I mean, it is, you get a vaccine and your baby dies. Now, if vaccines were not involved, then you would expect SIDS to be evenly distributed between birth and 2-month visit. Is really dangerous for infants. Their brain is so immature, and they're hit now, if you follow the AAP schedule, American Academy of Pediatrics, and the CDC sadly has been handicapped because they had started to make new recommendations and those got stopped by a judge's order. But bottom line is most kids in America still are getting a very aggressive vaccine schedule, and the 2-month visit and the 4-month visit are by far the most dangerous. We even know how it's happening. We're getting massive immune activation, brain inflammation, and if you inflame and shut down the respiratory center in the brain, babies will just stop breathing, and obviously in many cases, too many cases, they die. But back to that point, if vaccines were unrelated, those 2,000 or 4,000 deaths that are unexplained would be evenly distributed throughout the 60 days between the 2-month and 4-month visit, the 60 days between birth and the 2-month visit. They're not. These deaths, 100% are happening in those 60 days after a vaccine, not before. But by far, almost all of them are happening in the first 7 to 10 days. This is absolutely, once you understand we have the mechanism as explained, vaccines are killing babies, and it is tragic. It needs to stop.
Right, and the fact that they retracted and you can't find this study anywhere. So what actually was in that study, do you think, that freaked the dark side out so much they had to take it down?
I think the data was so powerful, and it's basically the smoking gun. It's basically proof. And more people, myself included, because I had a chapter in Vax Facts, more and more people were starting to reference that article because the data was so strong and so powerful. The system, whether it's the AAP, the CDC, the public health apparatus, that our whole medical system is geared towards avoiding vaccine hesitancy. That is more important than the health of the population, than the health of our children. And this is why so many good studies, like many of the vaxxed, unvaxxed, like my own, get retracted when they show data that is powerful and that really should create vaccine hesitancy. We have a dangerous system in place where vaccines are harming at enormous rates. I mean, SIDS is the worst, right? Your baby dies. But if you look at vaccine effects and side effects, I would say virtually every child who's vaccinated is harmed in some way. And they don't want this to become public knowledge because they want to maintain their profit margins, their system. It's like a religion. I mean, Aaron Siri's book was a great one, Vaccines Amen. He pointed out from a legal standpoint how very clear it was that this is not science. This is like a religion.
Some people say if vaccines can kill babies, then why aren't all babies dead? If vaccines cause autism, then why don't we all have autism? It's kind of a good question, but it's like, why do some have peanut allergies? Why do some not? So I don't know if you can shed any light on that argument.
Sure, I absolutely can. Let's just talk about smoking. So we now know smoking highly increases your chance of lung cancer, heart disease, and more early mortality, early death. But not everybody who smokes dies early or gets lung disease or even has significant heart disease, at least that's recognizable. I mean, we know people who smoke to be 100, like chimneys, right? So not everybody has the same level of vulnerability to a specific threat. And in the case of cigarettes, you know, a lot of toxins within smoke and carcinogens. The same thing goes for vaccines. A lot of toxins and immune disrupting chemicals within the vaccines. Direct toxicity, autoimmune inducing aluminum and immune disruptive aluminum in the vaccines, not to speak of formaldehyde, aborted fetal cells, and all the stuff that's in vaccines. Some people are just a lot more vulnerable. It's genetic vulnerability and other environmental factors that might make you more vulnerable. So, yeah, that argument that well, not everybody dies, well, that you just got to understand nothing is 100%. Some people are extremely resilient and can do a lot of risky things and still be okay.
And then some people say, well, okay, fine. The schedule is crazy. I'm just going to space them out. Well, we all know that one vaccine can kill a baby. One vaccine can brain injure a child.
Yeah. So, Polly, I am as guilty as many for early on when I was trying to figure this out. I thought just what you're pointing out. Well, maybe if we space it out, this will be safer. And I ended up publishing that data. It ended up getting retracted. It did show that it was safer than the full CDC schedule, but shocker in a way to me was the magnitude of which even the partially vaccinated kids were having a lot of chronic health problems. And I mean, we've seen this in multiple vax unvax studies. There's at least 12 of them out there that are well done, summarized, and they're all showing basically the same thing. The vaccinated, whether it's partially or fully, are all having a lot more uh, neurological and developmental issues in their children, a lot more allergy autoimmunity conditions, and a lot more infections of all kinds. That was a surprise to a lot of people. Wait, vaccines are supposed to protect, and no, they're actually making you more vulnerable to all infections. So it's a losing game if you want to vaccinate. The number one threat is vaccines.
Okay, here's one that's a little controversial. It's my opinion, by the way. But they say, oh, well, no, SIDS is because you put your baby on your tummy, you put it on your back, you put it on the side, you put it with a blanket. You co-sleep with your baby, and that's why your baby died. Well, I have to tell you this. The majority by far of the stories that I did of SIDS, those babies were not asleep in the bed with their parents. They were in a crib far away. Now, I'm not for a second saying that's what caused it, but all I'm saying is that whole sleeping thing, in my opinion, is super BS.
That was the fine work of the Academy of Pediatrics, who I used to think were the smartest pediatricians in America, if you will. But no, they are completely captured by pharma, and so they create narratives to confuse the population. So they had in the oh gosh, the Back to Sleep program was in the early 80s. I was in residency training at the time, and they just it's authoritative, right? There's no great science to prove that this theory is true. They just state it as if it is. So that program was, if you, instead of putting your babies on their tummies, you have them sleep on their back on a hard surface, nothing they could suffocate with, stuffed animals, blankets. I mean, it's craziness to put a baby that's been floating in the womb onto a hard surface and you wonder why they cry all night or why they're miserable. And I agree with you. The co-sleeping data for causing SIDS is extraordinarily weak. I just don't think it holds water. Theoretically, though, I mean, I remember being a parent with young children, and at one point in my early career like that, there were occasions where I might drink too much, and I'm thinking, oh, yeah, no. that could be dangerous because if you're intoxicated, clearly you could roll over on an infant that's in bed with you. Or if you're a mom and you're nursing at night and you fell asleep and sort of onto your baby, you could see how theoretically you could smother a baby. But honestly, it's not the reason that these babies are dying. You're absolutely spot on. It's mostly the vaccines.
Yes, it is. And I remember interviewing a pediatrician on the bus who stopped vaccinating, Dr. France, her name was, and she stopped vaccinating in the first 2 years. She did vaccinate him 2 years above if anyone wanted it. No SIDS. All SIDS are stopped. None whatsoever. And that for me was the biggest light. I was like, there you have it.
There you have it. No, absolutely. I want to bring up shaken baby syndrome because I have a confession to make. So, SIDS, the ICD code for SIDS, I think was in 1971. And around that same time was when they came up also with this shaken baby syndrome. So when I was in training in the early 80s, we were trained as pediatricians to watch for this because it was basically child abuse. At least that's what we were being taught. So the theory was, and I can't find where there's actual proof of this. You would have to have a video camera on a parent who's grabbing their baby and shaking them because they're just frustrated maybe with their crying. And then they just throw them on the bed. And that rapid acceleration, deceleration, theoretically, the brain bangs into the skull because it's floating in the skull, ruptures some blood vessels, they have a big brain bleed, and they die. You almost never have that sort of proof, like really almost never. If you did an autopsy of a baby who died suddenly unexpectedly and they opened up the brain, which they do, if it truly was shaken baby syndrome, you would have bruising on the front and the back part of the brain, right? Because they're shaking and that brain is going bang, bang, bang. And almost never, it just, that's not what they find. So they came up with retinal hemorrhages as a theory as to, oh, this is proof that it's shaken baby syndrome. So I was taught this, that retinal hemorrhages was pathognomonic. It's a long word to just say it is proof beyond any reasonable doubt. If you see retinal hemorrhages, it's child abuse. It's death from child abuse. And I regret to tell you that I taught that and believed it for probably a decade. And it wasn't till much later on I met Jim Meehan, who was an ophthalmologist first before he became really involved in the movement of, health freedom. But he was the editor-in-chief of a ophthalmological journal. And there was a study that was presented to him that showed that retinal hemorrhages were happening after vaccines. There was no evidence that it was happening from shaken baby. He couldn't get it published. Even as the editor, he was told, you cannot publish that. So this, destruction of our literature so that you cannot share anything that might disrupt the vaccine narrative has been going on for a very long time.
Yeah, and you know what? The thing that concerns me the most, and this is the thing that I want to get across to these young parents, if you decide to vaccinate and your baby dies, which it could do, you could end up in prison on first-degree murder.
Yeah.
It's a crime scene, what is going on at that. And I don't know why there's not more done about this. Babies have been killed by vaccines for years, and yet nothing is done about it, except for the parents are interrogated and some go to prison for life.
Yeah. No, I have another confession that to this day, I sometimes am just so sad that I didn't know what I know now. I had a really kind, loving grandma and mother come into my office. This was 20 some years ago, maybe 30. And they said, our dad is in prison. He's being accused of harming and shaking and, shaking baby, killing our baby. And we know it's not possible. He's the gentlest, most loving man. He denies it. We've been with him. I was with the baby all the time. It just didn't happen. And can you help us? And I didn't know how to help him, right? Because of the way I'd been trained. And so that's the problem. The whole system is misguided by the training that doctors are getting. And if that's all you know, that's all you know.
Yeah, and you know what, Dr. Paul Thomas, at the end of the day, when we know better, we do better. I mean, I vaccinated my kids, even when I brain injured with my child with the vaccine, I carried on and vaccinated my second child. I mean, we didn't know. You
Right.
didn't know as a doctor, and I didn't know as a mother.
Right. And that's why, a show like this, the Children's Health Defense, the Defender, their daily online magazine, is so important because if all you're getting if your information is just coming from mainstream media, you are getting a very sterilized, curated, and propaganda-like um, information. You are not getting the truth, which is why this is so important. And we need more parents to plug into good information.
I don't like it when I interview people and I say, "What's your advice to the young mum?" And they say, "Do your research." Well, actually, I did do my research. I spoke to my pediatrician. That was
Yep.
my research. There's more than that, isn't it?
Oh, absolutely. We all talk about the importance of informed consent. This is where you go to your doctor or pediatrician, if you're talking about a kid, maybe, and that doctor tells you the risks and the benefits and the alternatives. Well, early on, before I was aware of vaccine injury being a thing, when I was still indoctrinated and believing that vaccines are safe and effective and that serious bad outcomes are 1 in a million. I mean, if they truly were 1 in a million and that's what I believed, then my informed consent would be very different than how it is today. And in fact, very early on, before I was even aware of any of these risks, I would tell people, oh, they're completely safe. Something serious happening, 1 in a million. I mean, I quoted the garbage non-science narrative for about a decade. It wasn't on my radar. So you only get real and good informed consent if you're talking to somebody who actually knows all the data, not just what they're being taught by the CDC and the AAP.
And so then the young mum says, "Dr. Thomas, Polly, I hear you. And I'm pregnant and I don't want to vaccinate my child. My husband's not on side because he's scared that the child will die. My parents are not on side. Everybody is screaming at me that I will kill my child unless I vaccinate. And yet I'm listening to you two telling me that my child has a better chance of survival if it's not vaccinated."
That's absolutely true. And it's a disconnect, right? Because you are hearing a completely different and opposite opinion to what you thought and what you've been taught your whole life. I mean, the indoctrination of children starts in preschool. I mean, there's information about the wonders of vaccine being taught in grade school. By the time you get to high school, I mean, even one of my own kids wrote a paper about the most discredited doctor in the world, Andy Wakefield, who happens to be my hero and one of those people who actually followed the truth and lost his license for it, but he stuck to his guns because what he found was so powerful. You know Andy, I know Andy. He's a hero. But even one of my kids goes online, searches about this guy, and to this day, if you search, they keep his name smeared because what he revealed was so powerful and potentially detrimental to their vaccine paradigm and program.
Right, and it's like Neil Miller's being retracted, his study.
Right.
Basically, the moral of the story is if something's been retracted or there's a film they tell you not to watch. Remember Vax? They said, do not
Yeah.
watch the film. So if it's anything like that, or Andy Wakefield, or any of that, that probably means you need to take a look.
Yeah, no, my first example of that very issue was the conferences put on by the Autism Research Institute called Defeat Autism Now. They started around 2000, I think maybe a year or two before that. I wasn't even aware of them until 2002 when one of my patients said, would you go to one of these conferences? Her boys were quite bright, but probably on the spectrum. And she just had heard about it. She was an attorney. And, everything I was reading from the American Academy of Pediatrics, who to me at that time, that's who I listened to, was saying, oh, they were bad mouthing this particular conference. And I thought, I've got to go check it out. Wow. It was the most powerful science-driven conference I had ever been to in my life. That was it for me. I never went back to an American Academy of Pediatrics propaganda conference. I simply went to these type of conferences where you get real education, the information that they don't want you to know, but it's out there.
If that young mum is afraid, there's more to it than just not giving a child vaccines. Like you want the person to eat organic. You don't want it spraying aluminum deodorant all over yourself, your baby, putting Johnson's baby powder all over it and all that. There's tons of other chemicals that can affect your baby as well, as outside of vaccines.
Oh, absolutely. And thank you for bringing that up because, if you're about to have a baby, if you're pregnant or you're thinking about having a baby or you already have children, it is not just vaccines that are harming our kids' brains, their development, their immune systems, killing babies in the case of infants with SIDS. The total toxic load that our families and our kids are exposed to today is astronomical compared to even a generation ago. And so it's not enough anymore to just say, well, don't vaccinate, you'll be fine. Because, Polly, you know lots of people who are unvaccinated, and some of them have serious health problems for their children. So absolutely avoid pesticides, herbicides by eating organic. If you can, grow your own food, because even organic is being manipulated. And then we just did a podcast with William Parker, Tylenol. I've written about that in both my major books on vaccines. Tylenol magnifies the toxicity of everything because it blocks glutathione. And he's got data showing that Tylenol is a big culprit, creating autism, neurodevelopmental issues. So I've taught for a long, long time, actually probably over 20 years, get Tylenol out of the house, period. And he and I have a little disagreement about how significant Tylenol is versus vaccines. His point is, well, you don't know, because every time you vaccinate, the pediatricians are saying give Tylenol. It could just be the Tylenol. Problem is, from my perspective, nobody in my practice was using Tylenol, and I published my data, and the vaccinated still were way worse, way more developmental delays, ADD, ADHD, neurodevelopment, autism, the infections, the allergies, the asthma, everything. So it's not just Tylenol, but Tylenol is a big toxin. Get it out of your house. And then you've got to have really purified water, really good water. You need clean air that you're going to drink. There are so many things we need to do and be attentive to that are just as important, if you will, to paying attention to this vaccine issue.
And we're going to cover this more in another show. But where can people get Vax Facts? I highly recommend it to everybody, especially as new parents.
My website for everything I do is kidsfirstforever.com. There's links to Vax Facts there. If you want a personalized signed copy from me that supports me, the author, it's vaxfactsbook.com. And but yeah, this is available actually in bookstores everywhere. Some of the smaller bookstores, they may have to order it for you, but this book is in all bookstores. And it's sort of my attempt to give you the real informed consent. If you read that book, you will have the information that you're not able to get from other pediatricians.
Dr. Thomas, thank you so much for very valuable information on SIDS.
Thank you, Polly. I enjoy talking to you. Always look forward to these episodes. Never know exactly what you're going to throw at me, so I'm like, but we muddle through. Folks, you can reach me at kidsfirstforever.com. I enjoy talking to you every week, so tune back in next week, and thanks for watching.
Okay, tell us what happened.
Okay, so June 6th of 2021, I get a phone call from my husband's boss telling me that he's been in a semi-rollover and he's at Peace Health in Vancouver, Washington. He doesn't know anything and gives me the phone number to Peace Health. I call Peace Health. Peace Health tells me that they don't know anything. They don't have anybody named Lucas Anderson there, blah, blah, blah. I don't know anything. So I start getting the kids packed up and start heading. I try to call people to see, can I get somebody to watch my kids? Nobody can watch them. And so I head over to Vancouver to Peace Health. I get to Peace Health, try to figure out where he is and everything. The hospital won't tell me even if he's there. And the only thing that I knew was from his boss that he is there. And so I'm basically, trying to talk to these people, trying to figure out where is my husband and is he alive or is he dead? And so finally, they send a police officer or whatever, guard or whatever, armed guard, and I said, if you think you're gonna fucking intimidate me, dude, you got another thing coming, because I am not leaving here until I know what has happened to my husband. So my husband's co-worker calls, and he calls me in the middle of this, and I'm crying, of course, and everything, and he's like, well, my sister-in-law lives over there, let me see if she can come and watch the kids. So in the meantime, he gives me the phone to talk to, like, I don't know, the administrator or whatever. And I told her that I'm not leaving without seeing my husband. Go take him to a private room. She's like, I can't do that. I said, well, then come down here and stay with my kids while I go find out about my husband. She's like, well, I can't do that because your son is disabled. And I said, well, I'm not leaving without seeing what is going on. And of course, they won't tell me on the phone, is he alive or dead? Nothing. I have nothing, no idea. So this lady, who is the sister-in-law to my husband's coworker, comes, stays with my kids, but she only has a half an hour to be there because she's got to be somewhere else. So this stranger stays with my kids and watches my kids while I go up to the hospital. Of course, they force me to wear a mask and everything. I have no choice. I get up there. He's on a vent, blood's everywhere, his skull is cracked open, it's a mess. And there's all these nurses and doctors around him, they're all masked up. I can't tell who's a doctor, who's a nurse. I mean, they could be aliens for all I know. I mean, it was insane. And so I walked up, I grabbed my husband's hand and I squeezed it, and I said, Lucas, if you can hear me, squeeze my hand. So he squeezed my hand. He almost broke my hand, actually. He squeezed it so hard, it was insane. And so I told the nurse to take the vent off of him. And he's like, well, I can't do that. And I said, well, why not? And he's like, well, we need, all these different people to come. And I said, so go get him right now. So they go and get him. And I literally get the doctors to take the vent off him in the time that I'm there, and literally they're getting the vent off of him, and I have to tell my husband I have to leave. I have no choice. I have to leave now. So literally all I know is that, the doctor did come in and he's like, hey, he's got a brain bleed. We don't know how bad it is. We have to wait and see, blah, 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 blah. And I'm like, okay. So I literally have no idea if he's going to live or die through the night or anything, and I have to leave because I have to go and relieve the lady with my kids. So I go home and I'm just frantic because I have no idea if he's going to even live, anything. But at least he's alive when I leave, right? And so a couple of days go by and I have to find a doctor for him, all these different things to try and get him out of there. Because, of course, I'm freaked out because I'm like, I got to get him out of this place. This is insane. They're all masked up. He's brain injured. He's got a brain bleed. His skull's fractured. So, yeah, and only one visitor a day. It was insane because nobody could go out and watch him or anything while I was with the kids. So he's up there alone. Nobody to advocate for him. He's unconscious, and so we get through a couple of days of that, which is like no sleep, everything's crazy. Hang on, Christopher. No. Hey, buddy. And then they wanted to keep him in the so then they call me and they want to keep him in the hospital for 6 to 8 weeks. And I said, well, he's brain injured. And I'm like, he hasn't seen his kids for like 5 days. I'm like, you guys cannot tell a person who's brain injured, that has no idea where they are, what's happening, and they can't see any family or friends. How are they going to come back from that? And I'm like, he's not staying there. And I told them, if you guys can't change your protocols and what is going on, then I'm pulling him out. And so I literally go and pick him up on Friday. And they're like, well, we're not going to release him without a doctor's release. And I said, you can't keep him against his will or against mine. I am his wife, and you guys don't have any say over what happens to him. I do. And he is leaving this hospital whether you guys want him to or not. And it's hilarious. So the guy's wheeling him out, and the guy says to him, is it safe to go home? And my husband, he's like, no, it's not. I could have killed him. I'm like, what are you doing? Do you understand? I just spent the last 5 days in hell.
Are deadly.
But it was the most insane experience of my life. You have somebody that you love and care for, and these people are supposed to be caring for them and keeping them alive and helping them recover. And instead, they put me and my children and our entire family through a nightmare. It's a nightmare. I still have PTSD. I don't know that I'm ever going to recover from what took place. It was so insane.
Well, and when you told them about the me on the vent, why is he on a vent? They said protocol.
Yeah, that's true. They did. They said that the reason he's on a vent is not because of what happened, but it was the protocol of the ambulance and the doctors and what they did. And then they put him on fentanyl too. And he lost 2 days of any memories. He has no memories of CT scans, MRIs,
Yeah,
nothing.
She said I was awake Sunday night, and then Monday morning, the hospital, had a CT, but I don't remember that. So I was like,
Yeah, and how can you not remember a CT scan?
yeah.
You know, I mean,
Did
that's
they test him for COVID?
yes.
Yes,
They,
multiple
I
times.
and I went and I have all the records of all of this stuff. They test him for COVID multiple times,
Drug testing
and
like
they
6
drug
times.
test him like 6 times. I'm like, why would you need, the first 2 was enough. Okay, he's a truck driver. I know you want to blame him for the accident. It's always the truck driver's fault. And in this case, they couldn't really determine what caused the accident. They never really did determine what caused the accident. And Lucas has no memory of the accident, anything that
So you
took
were in a truck
Yeah.
a semi truck
and it rolled over,
and it rolled over.
and did something hit you?
No,
No, I was taking well, I could just tell you from where the accident was. So you take a right.
because they took pictures. He
but,
doesn't remember.
But my truck rolled over on the left side, and so the glass. So when the windshield, and of course insurance people's trying to ask me, I'm like, well, what could he hit yourself? The windshield right here from me, or hitting the
Yeah,
glass window?
his
And
whole
it goes
skull,
over.
like right through here.
Willamette Falls Paper Company, so they have like the big rolls of paper. So one of those fell over in the
Okay.
back of the.
Well, we don't know that,
We
Nay.
don't
We
know.
don't know any of
We
I
that.
don't.
think you're a very smart young lady.
She
Yeah,
is.
You have a lot to deal with. You have a lot to
Yeah.
deal with.
She does.
You love it, looking after your brother and your daddy and your mummy.
Yeah.
It's sad sometimes. So you're special.
Yeah, she's really had to go through a lot and at such a young age. It's been really hard.
And what did you say? What were you going to do when the security guard came up to you? Because you were next to mom. What did you
Please
want
don't
to
use
tell
the F
him?
word again.
Oh, sorry about that. That's actually what I did tell him, but sorry about that. Yeah.
Oh, okay.
I was pretty upset.
And quite rightly.
Yeah, I was very upset. It
I
was
just didn't want to hear it from this one.
Yeah. Yeah, she heard some pretty sailor language that day. She's like, she said, what did you tell Dad about, you've seen Mom 100% mad, but she was like 140% mad or something
she
like
said
that.
something like
Yeah,
that.
she's like, Mom went crazy,
Well,
which
so
I
they tried
did.
to kill you and they didn't. That's the main thing, because you wouldn't have it. So and so did you ever test positive? Is what I was
No.
getting? No. They
No,
couldn't. That's unusual.
Yeah.
they had no.
But they wanted to test him the day that we're leaving for COVID. And I'm like, no, you are not testing for COVID. We are leaving this place.
Well, and
There's no reason for
supposedly,
it.
Steph was saying, I don't remember it, but they would keep on having me, let's do this, having me sign this, even though I'm not knowing what I'm signing. And they're just like, sign right here. So they were having me sign stuff instead of going through her,
Did you get his hospital records up when he was out?
Yes,
So you
I.
saw what he was on.
Yeah, they put him on fentanyl. I couldn't believe it that they put him on fentanyl. I'm like, we have a fentanyl crisis. And then of course they tried to give him since his brain injury, they've tried to give him SSRIs. And I've gone up against the doctors on a gazillion occasions because I'm like, you are not putting he's already brain injured, so you take somebody with a brain injury and then you put him on an SSRI, and I'm like, not gonna have it. And of course, Lucas, the one thing that he has been constant about is, and it is probably because his long-term memory is fine, but his short-term memory is all messed up from his brain injury. But he remembered that he doesn't do drugs, so he's like, I'm not doing drugs. I'm not doing your drugs.
Good for you. You did not take the COVID shot.
No.
No.
Well, it's not on his records.
No, but what scares me, I was one of those, and of course I had to get blood transfusions, multiple.
Yeah, he did get
and
multiple.
that's June of
2020.
June 21. That's when for 2 months they're telling everyone, oh, donate, even donate. If you just got your shot, remember all that stuff? And that scared me too.
So you could have spiked blood.
Yeah, I could have spiked blood, but I don't know. Yeah, and that's almost 3 years ago now. Hopefully it's, left, but yeah, I could have had spiked blood because I had, 3 or 4 blood transfusions there?
2.
So now you're not able to work?
No.
No, I haven't. No.
I'm sorry, guys. This is really terrible thing that's happened to your family. Tell me about your brother. Tell me.
Well, Christopher was injured at 19 months, and he was injured by basically, I can't determine exactly which vaccine. I keep thinking it's the Prevnar, but he had multiple DTaP, Prevnar, all of them, and he had them, so young. But about 19 months, we thought that he had gone deaf.
Well, and of course the doctors are we're asking doctors, these people are saying, of course, we asked about the vaccine thing, of course they're like, not the vaccine. And of course we kept him vaccinated, I think until he was about 4.
5. Yeah, 5 was when we stopped vaccinating him. So he hasn't had any shots since he was 5. But he had 32 by the time he was 5, and I'm like, 32 shots? I mean, that's just crazy. And the challenge has been for me with autism and the vaccine injury and everything is that, first of all, as an adult, if all of a sudden I stop walking and talking, somebody would go and say, hey, like my husband with the brain injury, let's have a CT scan, let's have an MRI, let's do blood tests. There are different things to do. When it comes to autism, they're like, okay, we're going to send you to a psychiatrist, a psychologist who's going to do a behavioral analysis. Clearly, my son's fine motor, gross motor skills are not working properly. Okay, that is apparent in a child with autism. And yet, why are we sending them to psychiatrists? Okay, that makes no sense to me. If all of a sudden we're having stroke, and if you listen, like J.B. Hanley's book, I read it, and his book is our story about Christopher. I mean, it's verbatim almost, and I'm like thinking to myself, how is it that he can have basically the same story that we do? It's just crazy to think that. And there's so many families and now they're like acceptance, celebration, all of this stuff. And I'm like, we don't go around celebrating people who get cancer. This is crazy. I'm like, this is not a celebration that my son can't live his fullest life because his fine motor and gross motor skills aren't working. And he's nonverbal. And we know that it takes a lot of gross motor, fine motor skills to use your voice, but nobody thinks about that. And he should be able to ask you if he wants a glass of water. He can't ask anybody for a glass of water, and he can't sign it for you because his fine gross motor skills won't allow him to. And that's not fair to sit there and look at all these toxins and like what I say is nobody handed me the ingredients to vaccines and said, here, hey, take a look at this. Do you think this is good for your kids? No, our family doctor was 25-year family doctor. He went to our family's funerals, our weddings. He was a member of our community. Our family knew him for many and many years. And how is it that he can't know the ingredients in vaccines and said, hey, Steph, maybe you should think about this before you do this?
Well, and there was some stuff like during when she was pregnant with him, it was the whole swine flu, and they sign up. And the hospital actually had me and her older daughter Samantha got she was 11 at the time. She's May's age now. But we went and got the shots so we could be in the room when
you got swine flu shots.
Yeah, the swine flu.
So that they could be there for his birth.
And then I remember they asked Stephanie, and she said no. But even the vaccines.
I never took my kids for the vaccines.
She had Daddy take her every time, and then grandma took the older one too, so Dad took. So she had something in their gut the whole time. She didn't want to see it. She just didn't.
I knew in my gut, I think, the whole entire time. You know, it's almost like God was telling me, but it's like I just ignored it and just did what I thought was the right thing. But vaccines, you know, and now if I knew what I knew now, what I knew back then, my life would be completely different, you know, and my son would not be injured. I would have been a better mom. And not to say that I'm, you know, it's, you know, being a mom has its challenges in itself. Moms and dads, you know, we all have our crosses to bear, but
well, and every time when we were,
and when they say autism is a gift,
and every time he'd get shot, he'd get a shot when he was little, and in 2-3 days he'd be at the doctor's for something else, and then he had an ear infection,
infections, diarrhea,
and ear infection, and then he'd be on antibiotic, and then he'd get a big rash from that. So from
he had eczema so bad that he would literally take and he would like dig his nails in and just take his skin off. It was so bad. It was so awful.
Well, and allergies this time of the year.
Oh yeah.
Would have allergies, and then the last 5 or 6 years we've been given a teaspoon of honey, raw local honey. But they were sending me to all these dermatologists, all these different allergy doctors, and they were saying, "Oh, take this all over-counter allergy med beforehand," but nothing. But like, until he was like 8, and he used to be sent home from school because his allergies got so bad.
Nobody could take care of him.
And for about a month every year, and then so last 5-6 years I've had him on honey, and local honey, just a little bit teaspoon of honey a couple days a week. And his allergy, look at him, his allergies now broken.
Well, and we couldn't take him to the grocery store without him screaming at the top of his lungs, the lights everywhere. And I mean, it was just, he would, like, where he is now and where he was back for 5 years, we went with no sleep at all. He worked nights, I worked during the day, and we couldn't take him to babysitters. Nobody could take care of him. You know, and so we had to earn a living and try to take care of him. And, you know, everywhere we go, you know, we can go to weddings, we can go to parties. He'd just start screaming. And it was awful. I mean, and then the doctor, the specialist, said that we should put him on heart medication to help him go to sleep. And he told us, of course, there's no side effects to it. And, of course, Christopher would start just crying uncontrollably after we'd give him the medication. Remember that? But I'm like, we have to get sleep. We have to. We're not going to make it.
We found out that medication was given autistic kids early puberty.
Yeah.
And so
we found that out later.
Enough was your kid, Christopher, anyway, but like early, and the medication, there's certain stuff we went to a few years ago, they were showing on the slide of like kids going bald from the medication.
But the craziest story about what changed my world was a friend of mine. I hadn't slept in 5 years, right? And so I'm just exhausted and done the heart medication, all that. And one of my friends said, "Why don't you try to put essential oil on the bottom of his feet, lavender essential oil?" And I was like, I'll try anything. I'm so tired, you know. And we put some lavender essential oil on the bottom, and that boy slept for over 6 hours, 6 to 8 hours. And I'm like, why didn't a doctor tell me that? It was cost me like $12 to go to this little like store in Portland and
tell her when you switched Christopher to the organic.
When I switched, so I stopped going to MDs, went to a naturopath, and they said, put him on an organic diet, take out gluten. I'm like, I can't take out gluten. The kid eats bread like crazy. Okay, I'll go all organic. So I go and I start looking at all the ingredients, which was a scary rabbit hole to go down. So I pulled everything out and I put this kid on an organic diet. And it was like watching him go off heroin. I mean, it was insane. I thought, oh my God, I'm going to kill him, you know? I mean, I had him in detox baths, and he was like diarrhea. He couldn't go to school, basically. He was a mess. I was a mess. It was crazy. But after about 6 weeks of an organic diet, changing his whole diet, everything changed. Everything changed. He started sleeping through the night. We got 8 hours of sleep. He was happier. We could go to the grocery store. It was like our whole world just went from like hell to like, well, not heaven, but definitely way better.
And then after 3 or 4 months they're on an organic diet, of course, friends were like, oh, you should come to the birthday party. So we go on birthday party, and they had pizza. But they both end up getting sick after the pizza party, the birthday party. But it's like, oh, yeah, they got sick, so that's telling you. And other similar,
it's been crazy.
Your family's really been through it, haven't you?
Oh, yeah. So is yours.
Missing? Is there anyone?
Our oldest daughter is missing. Her name's Samantha, and I didn't ask her. She's in Michigan now, but she had 64 doses of vaccines. I see the injuries on her face. And she's my firstborn. And she took that damn Hep B vaccine.
What was it? Happy was the
HPV. Sorry.
HPV. Yeah, and we didn't know that she was in high school.
Yeah, and I didn't know all this, but I see the injuries in her eyes, you know, and to know that she is injured, and that I didn't know the shit that they were putting into our kids, and it's hard as a parent to not just be destroyed because you love them so much and you want the world for them, and to know that you injured them and that you didn't take the time. It's something that just keeps beating you up, and you want to let it go, and you're like, but I didn't know. And it's like, but I should have. And to know that every single one of my children is injured, though.
And you're telling Sammy you could trust your doctor. You thought it was...
Yeah, I did. I told her, and it was our family, and I'm like, you can trust them. But you can't. You cannot trust doctors. Not anymore. I don't think you ever could, really. I think they're just trained diagnosticians, and they write scripts. They don't know health. And if you have your arm cut off or you're in an accident, like, you know, Peace Health probably did say, I think actually the paratrooper that showed up probably saved his life, because he actually, there was a paratrooper that was behind him that saw the accident and actually got him out of the truck.
I was turning blue.
Because he actually swallowed his tongue.
And so the doctor from the hospital told, there's 2 reasons I was alive. One, the guy who pulled my tongue out, and then how healthy I was. If I had high blood pressure, diabetes, whatever, if I was at risk, I wouldn't have made it.
Yeah, they said he wouldn't have survived if he wasn't as healthy, which was because of Christopher, actually, because I put the whole family on an organic diet, because I'm like, after I saw what his body went through, I was like, okay, we're not, we're all going organic.
The last 6 months,
All right, let's end this interview on you. What do you want to be when you grow up?
She wants to be famous.
What do you like doing?
She loves
art.
You like art?
And singing.
And dancing.
That too.
Oh, tell Polly about your vaulting.
What?
You're vaulting. You're getting ready to go to competition. She's a vaulter. What do vaulters do?
They did like gymnastics, but it's on a horse.
Wow.
Yeah, pretty
Make
crazy.
sure you wear a riding hat then. No more injuries in your family.
Yeah.
I've been in
Well, we've been through it all now, Polly. So we're pretty much, we know the drill, right? At this point, we know what we're doing now.
Stay out of hospital, right?
Yeah, stay out of the hospital. Yeah.
Glad you survived.
Yeah.
All right, you're a great family. Thank you so much for doing this.
Oh, you're welcome. Thank you for having us. We appreciate you telling our story.
This and all CHD TV programming is made possible by generous support from viewers like you. Please consider making a contribution today to keep our programming going strong. Thank you.